Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then conditions where there is raised intracranial pressure and okay, where are the what are the conditions where there is raised intracranial pressure and what do you do actually? Now, what is the normal intracranial pressure? Normal intracranial pressure is almost 0 to 10 millimeters of Hg is the normal intracranial pressure. And what are the types of raised intracranial pressure? Types of raised intracranial pressure are: there can be vasogenic causes where there is increased capillary permeability is seen. This increased capillary permeability can be due to tumor or trauma, or it can be due to infection, or it can be due to cytotoxic cell death. Whenever there is cytotoxic cell death, mainly occurs cytotoxic cell death occurs due to hypoxia. This cytotoxic cell death can also cause increased intracranial pressure, or it can be due to interstitial causes. In interstitial causes, especially like obstructive hydrocephalus, whenever there is obstructive hydrocephalus because of the increased CSF in the ventricles, it can cause increased intracranial pressure. What are the these are the causes of types of raised intracranial pressure.
thank you and thank you for watching.